Welcome to the video podcast of the EHR Report. Today, we're going to discuss the road ahead, a trip into the future of healthcare information technology. Chris?
Well, thanks, Neil, and thanks for joining us. Well, over the past several columns, we've focused on the challenges presented by EHR technology as viewed through the experiences of our readers. The response to our request for feedback has really been astounding and quite encouraging. And in spite of our attempt to present a very balanced perspective, we've been forced to share the bias that folks have with their frustration with current EHR technology. But even with the challenges of today, we've always believed that there are better days ahead. We've constantly found ourselves asking, what will tomorrow look like for EHRs? And how will the questions of today be answered by the innovations of tomorrow? Will the questions even still apply? As healthcare continues to evolve, will it lead the change in technology, or will advancements in technology shape the future of healthcare? Well, recently, Neil, we had this opportunity to catch a glimpse of that future and find some of the answers to our questions while we were attending a users conference presented by a major EHR vendor. Now, as the company laid out its vision for tomorrow, several core themes were woven throughout it. We'll attempt to highlight a few of those themes in this video presentation, but we offer this disclaimer. While we came away encouraged by what we saw, we recognize that a lot of our listeners will actually be frustrated or challenged by the ideas that they presented. In fact, some might even find them threatening to the way that they practice. Now, if those ideas become reality, and it appears that many already are becoming reality, the landscape of medicine will be changed dramatically and hardly resemble the way it does today. In other words, regardless of whether or not we're ready for it, change is coming and will redraw the map for the next generation of healthcare delivery. We're going to talk about a few of the ways that that's going to happen. Neil?
Chris, those are great points. And really, the response from our readership has been remarkable. And I'd say probably about 8-2, talking about the frustrations of electronic health records. And I think we both understand those frustrations and also believe that sometimes the beginnings are hardest, that some of those frustrations hopefully will melt away as people both become more adept at using the technology and the technology that we're using becomes more sophisticated. One of the most significant themes that ran through the conference was this idea of patient engagement. In many ways, patient engagement has been the holy grail in medicine. We want patients to care as much or more about their health care than we do. Unfortunately, throughout history, any success with patient engagement was completely dependent upon the talents of the physician and the willingness of the individual patient. There really weren't tools that helped us make it happen. That's changing. Enhancements to existing EHR software are finally putting patients right at the center of their care. We've talked before about web-based patient portals, which allow patients to view labs and medication lists, but really this is just the beginning. Now vendors have created apps for iOS and Android devices which completely integrate with the EHR. This way, patients, and remember, we've talked in some of our columns about the ubiquity of smartphones. Computers are used by most people, smartphones by almost everybody. With these smartphone apps, patients are able to view their information and view it wherever and whenever they want to. They'll also be able to interact with their physicians in new ways. That will create new responsibilities and possibly some difficult to fulfill new time commitments for us as physicians. From a mobile device, a patient can schedule an appointment, check in upon arriving at the office without interacting with the front desk, and even retrieve a text message when the doctor's ready to see them. They'll also be able to upload readings from connected devices such as blood pressure cuffs or glucometers and see those data filtered directly into the EHR. Now, we realize that some might see this EHR revolution as detrimental to the physician-patient relationship. And there are also people who might say that it dehumanizes care. I think I'd say it humanizes care because it gives us the information that we need and want in order to make the decisions we have to make, And that in turn frees us up to pay attention to the patient in front of us. Throughout the last several months, we've received and published many concerns from many of our readership. But there's no question that patients who are more engaged in their care have better overall outcomes and also improved satisfaction. Also, the current generation of patients use their smartphones for everything. They don't like paper. They don't even like their PCs. They're all about smartphones, information where you want it, when you want it. The EHR vendors have decided to leverage that interest and commitment in an attempt to enhance care. For example, some new applications can remind patients about important interventions. You're due for a mammogram. You need your colonoscopy. There even are smartphone apps that, when organized well, can remind a patient to take their medicine at the correct time. And if the patient doesn't give a response that they've taken their medicine, increase the frequency of reminders until the patient responds that they've taken their medicine. Chris, some other areas that we saw?
Well, Neil, I think it's important to not forget that this world that we live in today is driven by data. Everywhere we go, everyone is talking about big data. In every industry, information has really become the currency of success. Headlines are everywhere. We're living in the era of big data. It's assaulting us everywhere. Data, data, data. And to be frank with you, EHRs are no different. They are essentially giant databases that collect a ton of information, things that we need to know about our patients, things that we need to know to make our jobs better, to do our jobs better. And so many of our colleagues resent this idea. They think that EHRs are forcing them to become glorified data entry technicians. I don't know if I really agree with that. I think that in many ways, data is helping us do our jobs better. But adding to their frustration, let's be honest, there's been a limited ability to mine data, to get salient information when you need it, and to really manipulate that data to improve outcomes and care outreach. But this is really changing rapidly. I was really encouraged to see that the health IT vendors are finally placing a high priority on data collation tools, and they're really trying to address our concerns that we've had as we've seen patients. In response to the changing trends in health policies, such as ACOs and value-based delivery of care, companies have developed tools that are allowing users not only to sort through their own data, but also harness the power of a connected health network and really finally deliver on the promise of true population management and community health. And let's be honest, that's really what we're hoping for when we even employ EHRs to begin with. Neil, do you want to talk about quality and how that's affecting things?
Well, I think that's a great point, Chris, and it's really about population health. And we talked about patient engagement being the holy grail. The other holy grail is population health and measurement of how we're doing with populations of patients that we take care of through acquisition of data on the populations that we care for. In the past, really the model of medicine has been waiting for a patient to come in. Motivated patients would come in and we'd take real good care of them, but we'd miss a lot of the patients that we were responsible for, that whose lives perhaps were distracted from, and therefore they never got in to receive the care that they have. With population management, we can sort data, we can reach out to patients who would benefit the most from coming into the office and remind them to come in. But then what are we doing? Are we reaching out adequately? And when we see patients, how are we doing with taking care of them? And that's really the quality chasm. Much of the confusion in healthcare policy today stems from countless quality incentive programs that exist both at the federal and state level. There's meaningful use, there's patient-centered medical home, there's PQRS and Heidi's measures. It's easy to become overwhelmed by all the different ways that our care is being evaluated and the way our care is being monitored. Thankfully, enhancements to electronic health records have begun to focus on quality and the measurement of quality, and the goal of that measurement is to streamline and automate the process of reporting. Bringing all those measures together, highlighting overlap, and simplifying data collection are really just the first steps. Many new tools now also offer suggestions for improvement and cost-benefit analyses to help providers determine which programs make financial sense and which will end up being more trouble than they're worth. Chris?
Yeah, I think, Neil, we need to acknowledge that a lot of these ideas are frankly controversial. They're going to be challenging to a lot of people. And, I want to encourage our readers. We hear you. We've read your letters, and we know that you're frustrated. And the things that we're talking about here today, we can be excited about them, but frankly, they're kind of scary. But I think the point here, Neil, is that all the things that you're mentioning, whether it be quality, population management, these are things that are coming, whether we like it or not. Not only are they coming in many ways that they're here, we really need to think about issues like patient empowerment because it's here, and quality assessments are here. And even though they fly in the face of the traditional medicine values of physician autonomy and respect, unfortunately or fortunately, depending on your perspective, these are the things that we're facing every day. Now, there are those who continue to resist complying with the trends. And I know we've talked to many people that are not complying with meaningful use. They're just not going to do it. They'll take the penalties, especially if they're close to retirement. And I can't say that's really all that bad an idea. In some sense, it might make good sense. But for the rest of us that are fearful that healthcare is becoming a commodity, we have to at least acknowledge that patients are now consumers. They're increasingly able to make informed decisions about how and where they purchase care. And for no other reason, that alone should force us to consider getting rid of the maps that we currently have and investing in a fancy new GPS system that can help guide us along the way. I mean, with how fast things are moving, we may not have the opportunity to stop and ask directions pretty soon. So I think that the things that we saw here were in many ways scary, but overall, I left very encouraged. I'm sure you felt the same way. We're moving in a very good direction, I think. I just think we need to embrace the trends and not rail against them.
Great points, Chris. For everyone at Family Practice and Internal Medicine News, thanks for listening.